Aloha, everyone. I hope you are choosing to see all of the best there is to see in this day. Welcome to Dr. P's Facets of Life series of podcasts. This is pod number 43. Today's topic, caregiving is a challenging role. Being a caregiver to a loved one, family member, or friend is likely to be one of the most important and most challenging roles a person will ever have in life. The challenges are all at once physical, emotional, and even spiritual for most of us. Caregiving is an age-old tradition of love and kindness that will become increasingly more prevalent as we move forward, given that we're living longer. Because medical advances and lifestyle changes allow us to live longer, we've learned how to live with and manage many serious chronic diseases and illnesses that might have been fatal in the past. It is likely that most of us will either need a caregiver or will become a caregiver. Most of us were not trained to be caregivers and may not have envisioned ourselves in such a role. Whatever the case, if we suddenly find ourselves in the position of needing to care for a loved one or friend, we may feel overwhelmed with this role. The good news is that we can all learn some basic skills and coping strategies that will make caregiving easier, make it more satisfying, and hopefully less stressful. A diagnosis of any serious or life-threatening illness, such as but not limited to cancer, coronary disease, diabetes, stroke, or a dementia, is usually a very traumatic experience for the patient and for the loved ones. There are so many things to deal with and so much information to sort through and understand. The days, weeks, and months following a diagnosis, an event, and/or procedure can be filled with overwhelming issues and emotions. It is extremely important to have some way of understanding what to expect and ways to cope with and manage the situation, not to mention the distress the situation may create. Information, understanding, coping tools, emotional support, and self-care are keys to how each person and their caregivers will experience what lies ahead. This is a journey that requires patience with the process, patience with the patient, and with oneself. Remember that impatience and unrealistic expectations increase stress, while patience and realistic expectations tend to decrease stress. A high level of stress or feelings of distress can interfere with the recovery process and quality of life for the patient, as well as create an ever-increasing risk of emotional and physical issues for the caregiver. Whether you are new to caregiving or not, there are some important things to be aware of. Learn about the disease or diseases and medical conditions in order to better understand what processes occur and how to best plan for care. Have conversations about the patient's treatment wishes, recovery requirements and expectations, and even end-of-life wishes whenever appropriate. If the medical condition is considered to have a poor prognosis, the patient would be wise to create an advanced healthcare directive. It's important to discuss when and how to create a durable power of attorney for health care and finances where appropriate. If need be, consult an elder law attorney on legal and estate planning matters. Gather with the patient present, family, and friends who are willing to participate in helping the primary caregiver. The primary caregiver needs to have a good support system. Some of the key ingredients to successful caregiving are as follows: education, resource information, emotional support, self-care. Did I say self-care? Behavior awareness, stress management, and a pragmatic approach to this role. Participating in a caregiver support group can provide caregivers with all of those things. A support group can offer safe, confidential environment where caregivers can share experiences, skills, ideas, and emotional support for one another. There are also some great books available to help caregivers better understand and prepare for this critically important role. There are also many online resources and chat rooms available for caregivers. And remember, you can always email me with any questions you might have. I hope this pod has been useful to you all. That's it for this time. Remember that gratitude is the best attitude. This is Dr. P saying aloha.